Welcome. In this video, we'll explore the essentials of clinical decision-making for physical therapists working with cardiovascular and respiratory disorders. The process is more than just following a checklist. It's a dynamic pathway that integrates assessment, goal setting, treatment, and ongoing reassessment. By understanding this framework, therapists can deliver more effective, individualized care. We'll break down each step, from identifying treatable problems to selecting evidence-based interventions, ensuring that every decision is rooted in both science and patient needs. Let's start by looking at the overall clinical management pathway and why it's so crucial for optimal patient outcomes. The first step in clinical decision-making is to identify reversible pathophysiology that can be addressed through physical therapy. This means looking for underlying issues that, if treated, could significantly improve the patient's function and prevent complications. Therapists must use their clinical judgment to determine which aspects of a patient's condition are amenable to intervention. This careful identification sets the stage for targeted, effective therapy and ensures that time and resources are focused where they'll make the most difference. A thorough assessment is the cornerstone of effective clinical decision-making. This involves a multifaceted approach: reviewing the patient's chart, conducting interviews to understand their history and symptoms, performing a physical examination, and analyzing laboratory test results. Each of these steps provides valuable data, helping therapists build a comprehensive picture of the patient's current status. This information is critical for developing a problem list and setting meaningful treatment goals, which we'll discuss next. Once assessment is complete, therapists compile a problem list, essentially a summary of all the issues that need to be addressed. Common problems in cardiovascular and respiratory patients include impaired gas exchange, poor cardiovascular function, decreased mobility, dyspnea, and altered cognitive status. Treatment goals are then established, often as the direct inverse of these problems. Importantly, goals should be client-centered, reflecting the patient's own priorities and preferences. This approach not only improves compliance, but also leads to better outcomes. With goals in place, the next step is to select the most effective treatments. Best practice means prioritizing interventions supported by the highest levels of scientific evidence, while also considering available resources and the therapist's own expertise. It's important to balance physical therapy with other patient activities, ensuring that interventions are both practical and sustainable. This evidence-based approach helps maximize the benefits of therapy and supports continuous improvement in patient care. A key tool introduced in this chapter is Dean's physiological treatment hierarchy for impaired oxygen transport. This hierarchy guides therapists in prioritizing interventions, starting with upright positioning and movement, then progressing to breathing control, coughing maneuvers, relaxation, range of motion exercises, postural drainage, manual techniques, and suctioning. While this hierarchy provides a useful framework, it's essential to individualize treatment plans based on each patient's unique needs and responses. Treatment selection should always be guided by the strength of available evidence. The chapter outlines 3 grades: Grade A, which is based on strong scientific evidence from controlled trials; Grade B, which relies on observational studies or less consistent trials; and Grade C, which is grounded in expert opinion. By understanding these levels, therapists can make informed decisions, ensuring that interventions are both effective and scientifically justified. Reassessment is a vital part of the clinical management pathway. Therapists must regularly evaluate the patient's progress using outcome measures that are quantifiable, relevant, practical, cost-effective, valid, and reliable. These measures help track changes over time, guiding further adjustments to the treatment plan. By focusing on measurable outcomes, therapists can demonstrate the effectiveness of their interventions and ensure continuous improvement. To wrap up, Clinical decision-making in physical therapy for cardiovascular and respiratory disorders is a structured yet flexible process. It starts with identifying treatable problems, followed by thorough assessment, goal setting, evidence-based treatment selection, and ongoing reassessment. Tools like Dean's hierarchy and clear outcome measures help guide decisions, but the key is always to individualize care. By following this pathway, therapists can optimize patient outcomes and deliver high-quality, patient-centered care.